The live stream is up. We'll be posting it to the website. Should be ready to go in just a few minutes.
The live stream is up.
Okay, Ms. Crystal, you can begin.
Okay, so we will go ahead and start with the roll call, which Ms. Varsha Castro Guzman.
I can't hear.
Dr. Craven here.
I'm here.
Dr. Nikolic.
Sorry, guys, was trying to unmute. I'm here.
And then Raven Lewis.
Good morning.
And then I am Crystal Chase Cercello, and I'm also here. And then go ahead. So I guess we'll go ahead and have the folks joining us. Do you want to have them introduce themselves that way?
Please, and then we'll introduce our staff after you get all your guests signed in.
Okay. I guess I'll start with Tracy. Or is she staff? I'm sorry.
Tracy is our staff.
Okay. Rachel.
Hi, I'm Rachel Chappell. I am here today at the request of Dr. Cresswell. I want to thank everyone for inviting me here. I also want to say that any views that I expressed today are my own and not representative of LSU or any other organization besides myself.
Brittany.
Good morning. Thanks for having me. My name is Brittany Booth. I'm a physician assistant that works at Ochsner West Bank, and I'm a full-time faculty at LSU Health Science Center. I'm also a ARC-PA site visitor for that's the accrediting body for physician assistant programs. And as well as Rachel mentioned, any opinions that I have here today are of my own and do not represent ARC-PA, Ochsner, or LSU. But thanks for having me.
And then I believe Sarah.
Thank you. Good morning, everyone. My name is Sarah Deo, and I'm a practicing PA. I work in pediatrics part-time. I'm the program director for the PA program at Franciscan Missionaries of Our Lady University, which is a bit of a mouthful. And I am the representative for LAPA. I sit on their executive board, and I am the legislative chairwoman for the organization. Thank you for having me.
And then I guess we'll move on with staff.
Yes. I'm Vincent Collada, Executive Director of the State Board of Medical Examiners.
We also have a board member, if Dr. Clark wants to.
I'm Dr. Rod Clark, a member of the LSBME. I'm here representing the board today on behalf of Dr. Johnson, who's currently serving as the president of our board. Thank you.
And I'm Dr. Lawrence Cresswell. I'm the Director of Investigations for the Louisiana State Board of Medical Examiners.
Hi, I'm Patricia Wilton. I'm one of the attorneys here at the board, and I assist with the PA committee. Joe, you want to go?
Yeah, that's fine. Joe Bunk, board investigator.
Tracy, Tracy Morrow, IT specialist with the LSBME. Olivia,
Hello, I'm Olivia Plong. I'm one of the executive assistants for LSBME.
Best for last? Jacinta? Is she
I'm
on?
Jacinta. I'm the executive staff officer.
Okay, do you have your script ready to go, Ms. Crystal?
We're gonna try. So I
All
think the first order of business is we've done introductions. So I believe that we need to approve the minutes from the December meeting. I need a motion to approve that.
Motion.
I believe I need a
Second.
second. Okay, thank you. And then the next set of business is something that says proposal for change, potential regulatory changes, stakeholder input. Is that something you want me to lead?
Well, just let me set the tone for what
Okay.
we're doing here. We are going to have a lot of listening today. We want to know how you practicing PAs want to change the rules to affect your practice, or that affects your practice and would make your practice better. And you need to tell us, and we want to listen. This will be the beginning meeting. We have some other business we do need to attend to also. I don't want to keep anybody all day and all afternoon. So we anticipate that this may take longer than usual. And we anticipate we may have to have another meeting either next month or whenever you all choose to meet again. We'd like to get all of your information, get it clear, put it in form you can review, approve, and then based upon whatever recommendations you want to make to change, once we get all of those approved by you, we will present them to the board for their approval. And then we will go on to implement whatever the board approves in the form of a rule change. So that's what we want to do mostly today, but we do have some other business that does need to be attended to. And so I'll let you take on, but I just wanted to set the tone for today and make sure you understand why we've invited so many people and why they can continue to be invited and why so many people, I hope, are watching, so that they can also send comments. You can send comments if you're watching to public comment at lsbme.la.gov. You can send them now during the meeting or after the meeting, and they will be made part of the record. Additionally, all of this meeting is being live streamed on YouTube, and it's consequently being recorded on YouTube. So please understand that we'd like everybody to introduce themselves and to state their name when they're speaking, so that anybody who's listening and not watching would be able to know what's going on. Thank you for allowing me to make those comments.
Okay, and if I can chime in too, Dr. Collada, what we envisioned for this first meeting, because Ms. Deo in particular may not be able to stay for a lengthy meeting today. And also she was desirous of having several other stakeholders involved in the discussions. So what we told her is that this meeting today is intended to be of an introductory nature. People can make some broad stroke type comments as far as where we want to go from here, but that any the hard work of putting together, potential proposals, what's on the table, what's not on the table, working out things like that, that will be handled in future focused meetings dedicated particularly to that issue. So I didn't want Ms. Deo to think that we blindsided her. Today is not going to be a lengthy, working group type meeting, but it is a time for our invited guests to go ahead and give their first impressions, broad stroke, kind of set the stage for future meetings. If that's my understanding of what the intent was. If I'm misstating anything, I'm sure somebody else will jump in, but that's what I believe Dr. Johnson, Dr. Cresswell, and myself, perhaps Dr. Clark, were under the impression that today would be.
Thank you for making that so clear.
So I think some of Dr. Cresswell's guests had more time to think about this and be prepared to talk today if he wants to invite any of them to say anything they might want to say today.
Sure, absolutely. If anyone wants to start, I guess I could start with Rachel, if you want to just give some preliminary thoughts. Again, as Ms. Wilton and Dr. Collada stated, our goal is really to hear from you all who are leaders in the physician assistant community, what any concerns are, if there's any way that we can address things and change them from a rule perspective. We just wanted to hear your thoughts. So I guess could start with Rachel.
Hi, I'm Rachel Chappell. I am a PA. I was a clinically practicing PA for many years. When I was invited to this meeting, and I want to thank you guys again for inviting us, I feel that my comments today, I would like to keep very philosophical, if you will. When you think about the relationship between a physician assistant and a physician, the rules and regulations of the State Board of Medical Examiners can be very concrete and prescriptive in a way that makes practicing it creates issues and problems where perhaps there are easier ways to do things. So one of the things that I want to make clear is that I think physician assistants always want to work with physicians. The other thing is when you talk about supervision and scope of practice, those terms can be difficult to really realize in some ways. And I want to say specifically, when I say supervision, I do think that that is something that supervision, collaboration, those kind of things are always something that we will have. But I think that at the heart of this, some of the rules and regulations around the scope of physician assistance takes the onus off of the physician assistant and puts it onto either a hospital or a physician in a way that's probably not the best practice. I think physician assistants, every healthcare provider has a scope of practice, and every healthcare provider has to be responsible for knowing what their scope of practice is. I'm going to reference Dr. Cresswell because I know him, he's here, and I've worked with him in the past. I am absolutely sure that there are things that Dr. Cresswell will not do in his medical practice because they are outside of his scope. That is similar to me. If there are things that I do not feel comfortable doing, then those are outside of my scope. It is my responsibility as a PA to know when to speak up and say that I don't know how to do this. And also it's my responsibility to know when I can do this and do this well. With the rules that we have now, that is shifted to the supervising physician. And I think that it doesn't serve either party well. And so I want to just say that as a just philosophical thing. I have to know when I'm outside of my scope, for any reason or anything, just like anyone else. And I don't think that's reflected in a way I feel is most useful in the rules. That's my comment.
Thank you very much, Rachel. I just want to clarify and just see if I'm understanding just one thing. Are you suggesting that there should be more input from the PA when defining the scope of practice or the clinical practice guidelines, and not just left exclusively to the physician writing that? Or how would you operationalize your recommendation?
I don't know how I would operationalize yet. I think that this is something that is bigger than necessarily even the clinical practice guidelines.
Mhm.
And so I don't know how I would operationalize that, but I think it's something, it is definitely something that I think is important and I think should guide the conversation around the concrete implementation.
Thank you very much. Thank you. Brittany Booth, do you have any comments, or I would appreciate to hear what your thoughts are?
Sure. Hi, I'm Brittany Booth. Quite honestly, I've been a PA for a very long time, but even in that sense, I don't really feel that I should speak on behalf of all PAs because it's only my experience and my opinion. So I am going to defer to Sarah Deo to speak on this a little bit more as she is representative of LAPA.
Thank you very much. Ms. Deo?
Yeah, am I unmuted? Okay, I think so. Okay, thanks again for having me, and I'm really happy and ecstatic to be at this table to speak with you all about this. So if I could just give a little bit of kind of organizational structure and historical perspective to the issue, and I think that might kind of help us understand how we got here and hopefully help us figure out the best way to kind of move on and what can be teased out here with discussion related to rules and whatnot. So LAPA does have an elected board, and that board unfortunately turns over pretty rapidly just based on our structure. So about 4 or 5 years ago, we decided that we really needed a consistent legislative committee that was really focused on these issues that the industry perceived as barriers to patient care and barriers to employment and practice. And so we set about creating a group that was representative of the entire state of PAs and also included people from diverse backgrounds in terms of practice areas, as well as other kind of niche things like PAs that had administrative roles, PAs in education, PAs that had experience with more of a business type background. And so we have a group of about 8, I want to say it's about 8 of us now, that have really been working on these things for several years. And we have developed a legislative or a policy strategy based on things that we were hearing from PAs throughout the state, as well as what we were hearing sort of anecdotally from administrators that are hiring us and reviewing annually policies and procedures, and doctors that we were working with. And we also kind of looked at national trends, and even talking with students and graduates who, said they plan to leave the state when they finish school, so that they could find employment in an area maybe that had less stringent regulations. So we've really tried to kind of holistically look at the issues that PAs are having, and I think probably, admittedly, set a pretty aggressive legislative agenda without really involving external stakeholders besides our PA group. So again, I'm glad this conversation probably should have happened long time ago, and so I'm glad that we're doing this now. But we had been asked back in early January to provide a list of what we felt were barriers to PA practice, and that list was shared with the advisory committee, and I've shared it since with Dr. Cresswell. And really LAPA, and I'm going to be completely transparent because that's just how I am, LAPA had vetted these issues, and we had internally felt like these were really legislative. These things seemed to be codified in the statutes, and we were unsure of where we could really get relief, significant relief or sufficient relief through rule changes. But the 4 big things that we have, and we sort of stratified them in 4 main categories, were 1, just the concept of supervision. And I think I agree with what Rachel was saying about philosophically, there's some issues with supervision. The role of the PA has evolved significantly since its inception in years and years ago. And it definitely, there's things that we feel like actually the board's hands are kind of tied based on how the law is written. But certainly the concept of supervision and the associated rules that have been promulgated around it are problematic. And it's probably too numerous to list in this meeting, but just some philosophical things we could talk about, just the definition of supervision. Don't have to be directly supervised sometimes, not all the time. And so that creates confusion. And really what we've seen in the heart of this issue is, for the PAs, is what we've seen is because of the discrepancies in definition and lack of really understanding what it means, we've seen PAs sort of preferentially being funneled into hospital, ER, surgical specialties where there's essentially direct supervision, and their employment opportunities have been sort of limited because of that. So that's kind of the big one for us. And then the ratio issue, I think that was brought up in the December meeting. I was listening in, and admittedly from the group that's not something that can be addressed because that's codified in the statute. And then direct billing and reimbursement. And this is an issue that really is honestly, it's complex beyond my area of expertise. So I'm not the legislative committee chairman or the legislative committee member that really understands this issue intimately, but I can just sort of summarize it as the inability to directly bill for PA services is problematic in kind of three main areas. So one, it creates a lack of transparency. So it's very difficult for PAs to really, or for their employers to assess how productive they are, because their billing is going out under another provider's MPI. And so when it comes time to evaluate somebody's performance, or it comes time to negotiate a pay raise, or those types of things, it's difficult for PAs to really quantify their services because they're not billing directly for them. It also, and this is a national initiative, and I'm sure the board is already familiar with this, it's ripe for fraud. And so there's a lot of initiatives being assessed from the Medicare and Medicaid services perspective to see if this really should be eliminated, because whether it's intentional or not, services are being billed under physician's MPI when the physician really wasn't involved and should have been reimbursed at a lower rate. So that's an issue. And then finally, the inability to directly bill does not allow PA to reassign their benefits to work for like a federally qualified health center. So those are just common things that nurse practitioners and physicians can do that PAs can't. And so that's been a barrier for us for employment in some of those centers. And it's just created administrative problems and headaches for PAs as well. That's actually one where I personally can't see that written into the statute. I do see it specifically spelled out in the rule, but I'm unsure, since I'm not an attorney, Ms. Wilton, if it's maybe not written in insurance law somewhere or somewhere else. But that's one I think we may, have some wiggle room. And then finally, I'm sure everybody knows that the profession changed its title recently, and we are very interested in changing our title here in the state of Louisiana. And so those are the four main things. But going back to number one with supervision, so I'll be honest here too. The objective of the organization was to, as Ms. Chappell said, was to always embrace that PAs work in a team model, and that we are ethical practitioners who, my scope may vary differently from Rachel's or Brittany's, but recognizing the limitations and where my guardrails are, and not going outside of those boundaries, but that we really, what is reflective of practice today is more of a collaborative model. And so working towards that end with regulatory changes is a very welcomed opportunity for the state's PAs.
Well, thank you very much, Ms. Deo. I really appreciate it, and I think that is something that we can work with. I did read the email that you had sent with those bullet points, and I think it's an excellent a starting point where we can definitely move forward and make headway. I'm gonna kind of transition back to Ms. Wilton or Dr. Collada for any other additional comments, or Dr. Collada had any comments?
Copious notes. I want to make sure that we get to work on this and get what you need. I appreciate the issue. I'll do some research on some of the things you've already said for our next meeting. And again, I think we're here to listen. So if any of the members of the committee want to make comments or suggestions on where we need to be going as we look into potential rule changes, we'd appreciate your advisory committee members to tell us what they think.
Are there any members of the PA Advisory Committee who want to comment on what's been said so far?
Yeah, this is Jimmy Craven. Look, I really appreciate everybody's, what has been discussed so far. As kind of a lead of a provider network across Louisiana and Mississippi, where we have probably over 1,300 providers, we're heavily dependent on the workforce of the advanced practitioners, and there are some discrepancies, and I do think there could be collaboration and kind of leveling the playing field a little bit. I think to some degree, I may take this opportunity to lean on my counterparts and other large health systems across the state, just to see, do we have consensus on where this may suitably land? So I appreciate everybody sharing their thoughts this morning. Thank you.
I work for I'm in primary care. This is Crystal. And I am actually the only physician assistant or PA in my organization. And prior to being hired, they didn't have any PAs. And so, I think there's always been, it's primarily nurse practitioner driven, which with obviously we have a few physicians, but it has taken a long time for them to understand even what PAs can and can't do from previous regulatory issues. And so I do think just from the primary care standpoint, I do think having this discussion and looking at what we can do to kind of open that up would benefit, especially working in rural Louisiana, because we have such a need for providers in general. And we are always looking for providers. And, I think the clinic system that I work for is at the point now that they're welcoming looking for PAs, but it's, I've been there for several years, and it's been a struggle in the past. So I do think this is a good place to start to look at these things.
I think that's I think what everyone has said has been very, very useful. And I really appreciate all the comments and the open discussion and the honesty. I'm a PA. I've been in practice for 14 years, all in pediatrics. I've worked at several different organizations here in the city. So I've had different models and different situations that I've worked in. I've worked in group collaborative practices with other PAs. I've been the only PA in another practice. And now I work in another practice where there's both nurse practitioners, physicians, residents. It's a mixed practice environment. And in seeing that, being in those variety of different situations and seeing how my role was changed or defined in different ways, I've had a pretty good perspective on what I think some people think and what I know other people think in terms of how PAs are best utilized. I like to kind of comment on Sarah's a comment on scope of practice. I think after practicing for 14 years, I definitely know what's my lane and what's not. And I think that's very important, as a provider, but also having that discussion with your supervising physician and making it more of a collaborative effort and everyone understanding this is my role, this is my lane, this is what I'm comfortable doing, and what his or her expectations are of my role. And so I do think that that the legislation should reflect that. If it's too stringent, then there can be no real collaboration. So I think that that this opening, this beginning is a good thing.
Can I add something? I don't want to violate the process, the rule, the order of which things happen here. Am I allowed to talk? Or? Okay.
Yeah, you're fine.
Okay. Well, I just want to add on to what Raven said. I think one of really the hottest topic buttons that we push when we go to the legislature is scope of practice. And it is not the intention of the LAPA to increase scope of practice for PAs. I'm just going to say it's not. I think that this is an inherent problem in the way the law and the rule is written, is that it's unclear what the scope is. And PAs function in different areas, and my scope may vary from Raven's, right? So these bills get labeled scope, and the sky starts falling, and that is not our agenda. And so I just wanted to make that clear. Are there opportunities to fine tune and make it more clear what scope is? And we've struggled with this before. I don't remember if you were around at Dr. Cresswell. I think it was 2010. Dr. Collada, I know, remembers when we came to the table again, and there was a lot of controversy around creating a big list of what are the services, what are the procedures, and so we've sort of left that alone, and that's not been an issue for LAPA. But that's not to say that things don't come up in PA's question, like, am I allowed to do this? And sometimes they come to us and we tell them, no, you're not allowed to do that, or as long as it's delegated to you and it's within your. So, but I think that this is just a great example of where there's not a whole lot of clarity, and it's a really challenging issue to resolve.
Absolutely, and I definitely appreciate that. It's one of the things where I think that we can all work together and really come together on the same page, because when I agree with you, when things are restricted from a legislative standpoint, it kind of binds the board, and it's more difficult to establish rules when you're limited legislatively. If you have a more broad definition legislatively, then it allows the board to then manipulate rules that may make it a little more restrictive, but you can define things better with the rules when you have a broader definition legislatively. And so, yes, I agree with you. It's something that we can definitely work on. And even if, there are changes that are going to need to be made legislatively, I think if we have buy-in from all stakeholders, LAPA, the advisory committee, the LSBME, all on board, then I think it one, will lead to success, and two, just a greater understanding and collaborative work, working well together. And even when, for my role in investigations, and as the director of investigations, my goal is really clear, is transparency. I want everyone to understand the law, understand the rules, understand what their what the boundaries are. And so, because there's so many times I'm meeting with licensees, and even in executive committee today, some of the advisory committee members will hear cases where someone just didn't understand the law and rules. And so, we may have to take action or recommend action, but it's an education deficit, So I think this is very good. And I think we'll be able to make some good changes. Yeah, thank you.
So if there are no other committee members, Dr. Clark may wish to say something, but I'm going to jump in right here real quick and just say where we go from here is if a quorum of the advisory committee members want to be involved in this particular issue going forward, that's wonderful. The more the merrier. we would have to notice those as public meetings like we did today. And then all of our invited, anybody who wants to participate. And I know Sarah's going to give us some additional names of people that need to be involved in part of this discussion, and anyone else who has other folks that they know of that could give us input. By all means, please let us know. We want everybody's viewpoint. We want everything on the table, and then we can go from there. But if for whatever reason, some of the committee members don't necessarily want to be involved in the working group part of it, and they want to jump back in when it's ready to be, finalized as a recommendation or something, then it wouldn't have to be a public meeting. It could just be an offline work group with as many outside members as wanted to be involved, outside participants. So I'm just putting that out there, because the next thing you will probably get on this issue after this is some reaching out as to when you might be prepared to meet again for, an hour, 90 minutes, a couple hours to really, get into the weeds on some actual changes that you might like to see, and let us know what a new rule or law might look like if you could wave your magic wand. So anyway, just from a procedural standpoint, that's where we would go from here.
This is Rod Clark. I just want to express my gratitude for being invited today. My presence here expresses the sincerity of our board to listen and to try to find a resolution to your concerns. So I want to let you know that the board is very sincere in what they're in trying to cooperate and what you would like to do to resolve these issues. So thank you for allowing me to be here today.
Madam Chairman, if I might make a comment, I would like to dovetail into the last part of what Dr. Cresswell said. On the agenda, Miss Susie was supposed to be with us today, but she does not appear to have joined us. We, on the direction of the board, have created laws and rules courses for all of our licensed classes. And there will be a law and rules course for all of the PAs. But in terms of when you take it, number one, you will have to take it after you get your license, not before, because that's the way we don't slow down people getting their license. And it'll have to be done before your first renewal, regardless of when you're licensed. And we have a tracking system that you will have to join. We'll be telling you all about that. But we will bring you a laws and rules course to, and want to bring it to one of your meetings so that you can see the course. And in executive session, we will review the actual test. And then we will also make it available, while it will be required for your first renewal, regardless of when that is relative to your granting the license, you will have the opportunity to use it for continuing education hours on a free basis every year. And you can take it as many times every year if you want. I would urge you to maybe consider, as an advisory committee, a recommendation that maybe every 2 years or every year, because as laws and rules change, we would update your course. And that way your licensee class, all of your PAs would know what the laws and rules are. And I think that will eliminate the concern that Dr. Cresswell told us about, that sometimes people don't know the laws and the rules. So that's one of the things that we will be working on and would like you all to be participants in after we make those changes.
All right. Thank you, Dr. Collada. And I do agree completely. That's excellent suggestions. And that's one thing that we worked very, very hard on, is improving the rules course actually for all of the categories of our licensees. And really, I want with the goal of ensuring that, ignorance of the law and rules is not a defense. You know, we want people to know the law and rules, and also even going forward, what the consequences would be, you know, if those laws and rules are violated. And so, yes, I encourage that people take the course as it's added to the website.
Okay, Crystal, if nobody else has any more comments about this particular agenda item, I think you can move on to the next one with the grateful thanks to everybody involved for the participants that joined us for this item.
Ms. Crystal, if I could make one comment for housekeeping purposes, for all of the advisory committee members, you are considered under the laws a public servant, and you will have to take some specific education, one of which is an ethics course, and the other is a sexual harassment course, prevention of sexual harassment. You will be issued what we call H number. If you are a state hospital or a state employee, you already have a P number, and you will just need to let us know that you have a P number, and we will not have to issue you an H number. But with your P number or your H number, as it's termed by the state, you will be able to access the online courses that you will need to take to fulfill those requirements of the law with regard to this statewide education. Sorry, the phone was ringing. I had to get off that. But anyway, you all will all be able to take those courses, and you must take them every year. And Jacinta will be sending you those H numbers in the not too distant future. So when they come, you'll know what it's about. And like I said, if you already have a P number, because you work at a state institution already, service district hospital, anything like that, you can send that information to Jacinta, what your P number is, and we'll make sure we can track you up to that. Again, I'm sorry to get those little housekeeping details.
We can't, something's wrong with your mic, Dr. Collado. We can't hear you.
Yeah, your volume.
Now. All right, give me 1 second, see what I can figure out. Can you all hear me now? No. Okay, it's working from my end. Can you hear me now?
Yeah, you're good now.
I'm sorry, I don't know what happened. Anyway, if you have a P number, please tell us about it, and we'll make sure we can track you by your P number. If you don't understand that these courses are mandatory for all of our state employees and public servants once a year, our board members will have to do it. You will have to do it. I have to do it. And like I said, if you're already a state employee with a P number, perhaps through LSU or something like that, we just need to know what it is so we can track that you've done those courses. And I'm sorry to take up a little bit of time, but I need to get those housekeeping details out to you all.
So if we're not a state employee, we'll just need to do the course when it's sent to us via email?
No, it's not going to be an email. You will get an H number if you're not a state employee. And then at your leisure, you will be able to sign on to Leo. We'll give you the link to that. Take the courses that you need to take. And then once you take them and pass the little test, we have a record of it, and that will meet your requirements to continue functioning as an advisory committee member serving the public in the state of Louisiana. Did I say that wrong, Pat?
No, you're correct. I mean, there's also a different way to take the ethics without a number, but point being, if anybody has any questions, just feel free to reach out to us offline. We'll make sure that you're in compliance, and either Jacinta, Dr. Collado, or myself will make sure that you're good to go. And they're two different 1-hour courses that the legislature has determined that all public servants in the state of Louisiana have to take on an annual basis, including themselves, including the governor. And by virtue of your having been appointed to this committee, you are deemed a public servant under that rule. But unfortunately, we're making it way more complicated than it really is. So, but we'll reach out to y'all with the proper instructions. And of course, anybody who's already taken it, as Dr. Collada said, in your current employment, we can just track that.
I want to circle back to the looking at rules and everything for next steps going forward. Should we just by email planned to a meeting date, or what would be the advice on what you want us to do with that?
If you ask my opinion, I think given the scope that we have and the number of things that need to be addressed, I would suggest at a minimum monthly meetings. You could pick a couple of months right now so that everybody can start clearing their schedule. If Saturday works for you, Saturday works for us. If you want to do it at the end of a day on a weekday, and that works for us. Our staff is here to service your needs in this regard because we want to get this done. Because whatever it has to do, it ultimately has to be approved by this advisory committee. It then has to go to the board for their recommendations and input. And then we can begin the rulemaking process. Now, understand the state of Louisiana has, by definition, made rulemaking somewhat lengthy. It takes, with a tailwind, about 6 months if we're lucky. So again, I want to tell you that the sooner we get all of the information flushed out that you want to change, and Pat and I and Dr. Cresswell can work on a document that we can then show you is what we're going to recommend to the board. Make sure you approve it. Then it goes to the board. And then if they say, take this point, modify that point, whatever they tell us to do with each of those points of change, and we go ahead and draft a rule and start it in the process of getting a rule change. So we want to make sure you understand that it's in your best interest and our best interest to meet frequently to get this done. And as Ms. Pat said, if you do not want it to be an official meeting of the advisory committee, that's fine with us. We can get the other members that want to be involved who are not advisory committee members to do this. The other guests that are present, and maybe more from those from LAPA. But the key is, if you're going to do this as an advisory committee, you'll have to have a quorum, and you will have to have, we need to get those scheduled and get them running for you.
And also, as you're thinking about structure and how you want to handle it, if you want to think about the points that have been raised, the big issues, one thing you might want, you can do it one of two ways. You can have a big marathon meeting, let's say on a Saturday morning, where you put everything on the table and talk about it, or you could have a series of 1 hour, 90-minute meetings focusing on a specific topic, like as an example, the 4 structural positions that Miss Sarah had pointed out. If those represent the broad strokes that we need to talk about, either way, we want to be respectful of your time. And so whatever way works best for y'all is 100% fine for us. But we've done it in different formats, both ways, either, just a half a day where you hash out everything once and for all, and then you come back and review a draft, and then you make some minor edits, and then you're done, or you do it sort of on an issue by issue basis in shorter chunks, and then you come to the result of a draft document. So just whatever y'all think.
Would it be possible to say that we could plan a meeting for something like the second Saturday of September? Oh, I'm getting a head shake from Raven. Just looking at our calendar. Or maybe the 3rd, but then we figure out who all plans on coming to figure out if we need to have it as a public meeting. Is that a possibility?
Yeah, that makes a lot of sense. So the 3rd Saturday in September would be September 17th.
And we are comfortable however you want to do it, whether it's a public meeting or a private meeting.
Okay.
And whether you want to do a big half a day or,
Okay. Raven, is there a Saturday that works for you?
I don't want to be the deciding factor. I've committed myself a lot on Saturdays. And so like you say yes to a lot of things. So the third would probably be better, but I'm not 100% sure I don't have something else on that day. So just make it for where majority can, and then I'll figure myself out, because I don't want to be the deciding factor or keep, or slow anything down.
So my next question is, so I know you could do the meetings in person in July, but in August they're on Zoom. Does that apply? Like, what happens going forward?
We can do everything on Zoom as an advisory committee meeting if we do it as a meeting of the committee. Obviously, if it's not a public meeting of the committee, we can do it teleconference, yes. However, if anybody thinks that sitting together around a table somewhere is more productive, we're happy to host you at your offices. We have a big old room and can have as many people who want to come and visit with us, get some lunch in, whatever you want to do. So that's another option that you have available to you.
Is anybody opposed to meeting in person?
I could potentially do person on a Friday. I work in Baton Rouge every Friday at the Ochsner there. So I could be open to amending my clinic schedule to maybe meet a half a day on a Friday. That would actually be a little bit better for me than the Saturdays.
Meeting would take place at our office in New Orleans, Ms. Raven.
I'm sorry, I apologize. Yes, well, I could come back on a Friday or any Friday really then, because I'm here all the time. So that's fine.
One of the things that we do not have the ability to do at this time, technology-wise, is to broadcast the meeting if it's in person. The board has not chosen to put that technology into place. And so we would, if you want more participation, more people from other parts of the state to be able to participate, it may be more beneficial to use the technology of Zoom. The technology of Zoom, we asked it to occur because we felt it gave more opportunity for more parts of the state and more people to participate both in a live and committee type fashion. And that was recognized by the legislative body this year. And that's why it had to be after August 1st, because that's when the rule changed officially. And that's why we couldn't do it in July, but we can in August, and henceforth we can until the laws change. And I don't anticipate it being a change anytime soon.
And just to offer, I don't know if Dr. Collado was not wanting to go this route, so hope I'm not opening a Pandora's box, but if we were meeting in a group that did not include a quorum of the advisory committee, less than a quorum of the advisory committee, we could have persons participate remotely. We could have people around the table, and then we could have participation by remote participants through that way, but we couldn't have an advisory committee meeting that way.
Thank you for clarifying that, Ms. Pat. I did not say that, but yes, that is true.
So would it be possible to look at the third Saturday of September and then we do an email poll to figure out how many advisory members will be there or plan to be there, so we can then figure out whether it's in person or Zoom?
Sure. Right. Okay. Jacinta can send that out to everybody on this call. And then also, if you have anybody else that you would be interested in inviting to that meeting, if you'll just let us know, we can pull their availability as well.
Okay. All right. Are we ready to move forward?
Yes, ma'am. You would need a motion to go into executive session. And at that time, we would excuse Sarah and the people, Ms. Rachel, and people who are not members of the advisory committee to go into executive session. If they choose to stay on, they can. And when we come out of executive session and make motions, they can be privy to what we see. They can see us making the motions and taking the vote.
All right, give me 1 second.
She's going to change that right now. Before you change, hold on. Did you want to say something, Ms. Crystal?
I was going to say thank you for the outside members or outside folks for joining us. And then I do need a motion to move into executive committee.
A motion to move into executive committee.
Second it.
iPhone, who is iPhone?
It's Jimmy Craven, maybe.
Hello, did you say you're Dr. Craven on the iPhone?
Yes, that's me.
Okay, I'm gonna let Jacinta know. Are you on iPhone, like on the Zoom app? Or did you call in?
I'm assuming I'm on the Zoom app, but I can log out and try to log back in.
No,
Get the
you're
link.
okay. Because it doesn't say your name, Jacinta wanted to make
Okay.
sure.
All right.
But
All
I'll
right.
get you just a second. We'll get you
All right.
over.
Thanks.
Do we have everybody?
Believe so. And just a reminder, say the case number and not the name.
All right, we will move into the investigations portion of the meeting, starting with case 2022 I-199. We need a recommendation.
Okay, the PA Advisory Board has made the following recommendations for this case. We've recommended 6 months of suspension, 2 years of probation with the following remediation: that the PA will attend a rules and laws course, an ethics course, a proper prescribing course, as well as practice monitoring and on-site supervision.
Okay, that's in the form of a motion by Ms. Raven, and then is there a second?
Need a second.
A second.
And then all in favor of this, please say aye.
Aye.
Any opposed? Okay. And then we will move on now to case 2021-1406. We need a recommendation.
The PA Advisory Committee recommends for case number 2021-1406 the following: a public reprimand, a fine in the amount of $1,000, and recommendation for the PA to attend a rules and laws course.
That's a motion from Ms. Varsha. We need a second.
Second.
All in favor say aye. Aye. Any opposed? Motion carries. All right. Are there any other matters that we need to discuss?
Not at this time, not from investigations.
I believe the last thing says attorney advice, but I think we've gotten that. Are there any other discussions for this meeting?
I want to thank all of you all for the work you've done today. Ms. Jacinta will get out the invites for the next scheduled meeting, as we discussed earlier, and look forward to seeing and working with you all throughout this year to try and make some meaningful changes that you desire.
Thank you.
Thank
All right,
you.
thank you. Thank you guys very much for everything.
We need a motion to adjourn.
I move to adjourn the meeting.
Second.
Thank you.
Thank you all.
You guys have
Bye,
a great
everybody.
weekend.
Bye.
Bye.
Bye-bye. Bye-bye.